I have a son who is born with a cleft lip and palate. Let's discuss it. So, on my very first YouTube video, I wanted to discuss something that is very close to my heart, and that is my son. My son was born March 6th, 2025, with a complete unilateral cleft lip and palate. If you guys do not know what that is, that means that part of his lip, this side, and then all the way down his gum to the back of his mouth was open. It never closed fully. So I wanted to share some insight and hopefully be able to show other parents or other caregivers what it's like growing up with a cleft lip and palate for my son's perspective. So my son is now 15 months old. He is the happiest little baby, but he did have some problems along the way. So let's start from the beginning. So my son was born on March 6th, 2025. And whenever he was born, he did have a full, complete unilateral cleft lip and palate. We found this out at my 20-week scan. And so I was a lot more prepared. Some people who get their anatomy scan do not even see a cleft palate. Sometimes it can hide. But luckily, we were able to see both of his so that I was able to prepare a little bit more for the future. So, my son was born at 7 pounds, 1 ounce, and they thought that he would have problems feeding. A lot of cleft babies have problems feeding. Now, most of this is because without that roof of the mouth, they have no suction, which means they cannot drink normally from a bottle. Whenever my son was born and we were attempting to get him to drink out of a bottle, he would have to chew. So basically, instead of suckling, he would bite down on the bottle nipple in order to get milk out. But you have to use a special bottle for this. There are multiple different brands of bottles. They have, Pigeon bottles and Dr. Brown's, and I think even Medela has special bottles made for these purposes. And what they pretty much are is they have a black backflow container or piece on them, and whenever the baby bites down and milk pours in, it does not come back out. That way that they can actually clamp down and get the milk into their mouth. So whenever you have a baby that has a cleft, they need to see the doctor a lot more regularly, which is a given with any baby that comes into the world with any type of medical or health problems. So my son's first pediatrician appointment was whenever he was 1 week old. Whenever he was 1 week, we went to his pediatrician's appointment, and he had actually lost weight instead of gaining weight. It can be normal for babies to lose a little bit of weight whenever they first leave the hospital. But my son went from 7 pounds, 1 ounce to 5 pounds and 10 ounces, which is quite a big drop. So they were a bit concerned that he was not getting the amount of food. And the problem was that he wasn't getting, not that he wasn't getting the amount of food that he needed. It is because the type of bottle that we used, it did not flow enough for him to eat. So he was eating much slower and it was taking him a lot longer. So he was burning excess calories actually trying to eat the bottle than he was actually getting from the nutrients inside of the bottle. So we eventually learned a trick that I would like to share with all of you parents out there, which is if you take your sweet baby and you lay them on their side, kind of like a football hole, and you're going to lay their head on the outside of your body, and you're going to take the bottle and you're going to squeeze. Squeezing the bottle is going to help some of the milk flow a little bit faster, and then that way it takes them a lot less longer to eat, and then they can start gaining weight. So on his second appointment, which was a week later, he had gone up from 5'10" to 6.3 ounces, or 6 pounds 3 ounces, which is a lot more in the correct direction. They were a lot happier with that, and he started gaining his weight. At that time, she did put in referrals to see the doctors that he was going to need for his upcoming, like, surgeries and all of that. So we got in touch with an ENT specialist. He needs a plastic, like a plastic surgeon, for whenever he is a bit older. He is also deaf in his right ear, and that is because whenever a child with a cleft is born, a lot of times the shifting of the cleft can cause the ear canal to become a little bit wonky, and sometimes the sound does not travel correctly through the ear, which seems to be the case with him. So my son was 3 months old whenever we got in for his first surgery. He has an amazing surgeon. She takes very great care of him, and she is very precise. So whenever she does her surgeries, they do take a little bit longer just because she wants them to look as good as possible. At 3 months old, my son weighed 11 pounds. He was quite small still, and that is kind of the threshold for being able to have surgery, is they need to be at least 10 pounds. So because he hit this threshold, we went ahead and went in, and because of the shape of his palate or his lip, what they did is they took this piece and they just kind of form fitted it over to try to get it to lay flat. I will insert a picture in here, you know. So it was quite far over. And they wanted it to lay a bit more flat before they did the final surgery so that the scar would heal a little bit better. Now, after surgery, whenever your baby comes out of surgery, it is probably one of the worst things that I have ever felt, because he was in so much pain and the anesthesia was wearing off and he did not feel good, and I could not fix that. They give you a syringe, and for my son, what they gave is they gave a 10 milliliter syringe, and they gave a pink, it's like a catheter almost and stuff, and you stick it on top of the syringe so that you can pull milk into the syringe, and you place the end of the pink tube like in their gums and push the plunger down so that they can drink milk. My son had to have that for almost 3 weeks. He was still gaining weight. He was okay. They do give you Tylenol, and while you're in the hospital, for my son, they gave him a little bit of ibuprofen while he was in the hospital, but he was not able to take the ibuprofen outside of the hospital because at that age, it's under medical supervision to have ibuprofen for children under 6 months. After surgery, he had to wear these little devices, which are called like no-nos or like don't touches and stuff like that. What they are is basically just a arm restraint that goes over their elbows, and it wraps around so that they cannot bring their hands to their mouth because they have those stitches and they did not want them to pull. Unfortunately for my son, his stitching decided to come apart about 5 days after surgery. And so eventually, his lip reopened back to where it had started to begin with. I did call his doctor and I talked with her, and they were able to explain to me that it was okay, that surgery was to pull something down, not to completely fix it. So it would be all right, but he was going to have to wait at least 3 months before having the full surgery to completely close his lip. Now, after he had healed and things started getting back to normal, we had spoke with his surgeon again. Once he had his second surgery, So, second surgery wise, my son did a lot better with the anesthesia. And because of his age, he was sleeping a lot better through the night. So it did make things a little bit easier for the hospital. Um, Now, both both times he had surgery, he did have to stay overnight in the hospital. And this is because they want to monitor and just kind of make sure that everything is okay, everything's healing properly, and that they are eating properly before they leave. Again, after the second surgery, he did have to use the syringe with the tubing in order to eat so that he would not mess up any of his stitches. I will post another photo right here of my son after surgery for the second time. He's so cute. Um, he did great and it looks fantastic. Um, After that, he started being able to eat a little bit better, but because he has the entire roof of his mouth is open, there are some things that are just a little bit harder for him to eat, but he is getting there. Now, one thing that I did not know is that your baby will not be able to speak properly if they have a cleft palate. And what I mean by that is letters like P, T, and like the K sound. They cannot make those sounds because the roof of the mouth is open and there is no pressure to force the words out. So, my son at 15 months old, he says mama and he can say nana. And that's about as far as he kind of goes with that. He can't say other words. We do try to help along the way. Um, but it's not something that's going to be fully fixed until they fix the roof of the mouth. Now, in between these visits, my son also has therapy. So, therapy wise, you want to get your kid in a bit sooner because a lot of times babies that are born with a cleft lip or palate, they can have some problems like with the shaping of their head. And my son's head came out a little wonky, and he ended up needing a helmet for a little while, which I will also post a picture because he's just too damn cute. Another thing is he was a little bit more delayed with like sitting up and crawling and walking and all of that. So he was in therapy for a while for that as well. And after the palate of in his mouth is fixed, he will probably also need partial feeding therapy to make sure that he can eat food properly. Um, Now, like I said, every baby is kind of different on this. So, my son, he can eat quite a bit of stuff. He eats like noodles and pasta, and he has like chewy granola bars and Pop Tarts. And, he can obviously have like yogurts and fruits and like cooked vegetables and stuff, and he can eat them just fine. Um, but until that roof of the mouth is fixed, a lot of things that are harder to eat, like in crunchy foods, he is not going to be able to eat those properly. Another thing that I wanted to talk about is that his third surgery is coming up. Now, his third surgery is his palate surgery. They will not do palate surgery until your baby is at least a year old. Um, and after they have completely healed from the last surgery, they also want to make sure that they are getting to where they're eating more food and that they're mostly off of a bottle before they do this next surgery, because having like a pinky or anything like that inside of the mouth whenever they do this surgery can cause the stitching to rip open. Now, I do not know much about the surgery. I have read a little bit about it, and I have spoken to my son's ENT specialist, and she has said that it's fairly simple. So basically, they're just going to split the hard and soft palate, fix the nasal cavity, and then fix the roof of the mouth. It is roughly a 5-hour surgery for this next one as well. And then after this one, he should not need another surgery until he's about 9, which is when they're going to fix his gum. Because even with the palate fixed, my son's gum has been separated due to the movement and shifting of his bones not fusing together whenever he was in utero. So, um, hmm, I don't know what else to talk about. the number of professionals that your child is going to need to see depends solely on their cleft. So babies who have just a cleft lip, they might end up with just 1 or 2 surgeries, one doctor plus their pediatrician. Babies who have more complicated clefts like bilateral clefts, cleft palates, or complete cleft palates, which is where the entirety of the roof of the mouth is gone, are going to need other specialized care as well. So my son, for example, he with his type of cleft, he has a pediatrician, an ENT. He's got feeding therapy, and then he is also going to need a plastic surgeon to fix his gum line. I hope you guys enjoyed my very first video. I highly doubt anyone is going to watch my very first video. In the words of Mr. Beast, like no one's gonna watch your first video. So that's what I'm kind of hoping right now and stuff. I don't feel like being a purple cow today. But if you guys do happen to come by my video, don't forget to subscribe for more tips, and let me know in the chat below what you guys would like to discuss next. Don't forget to subscribe.